Stroke in young people is a huge problem. Overall, the incidence of stroke in the whole population is decreasing because the management of stroke is getting better. But in young is still a huge issue. You might have stroke around 35 years of age, and by 50 there is already cognitive decline, and there is no way to prevent that. People are in the stage where are working, they have a family. The problem with stroke is that once you have one, it's really likely they reoccur. So in the first 5 years post-stroke, you might have another stroke, and that can cause even further problem to the person, might be unable to go back to a normal life. Unfortunately, there is no treatment or cure for stroke in young adults, and until we don't really understand how the disease works, what are the causes, what is the cascade event that promote the stroke, we won't really be able to develop new therapy. Some of the causes are still unknown. Some are due to the type of lifestyle, diabetes, hypertension, and some of the causes are genetic, and that's the one we are investigating. So with my fellowship from the foundation, I managed to set up my own research project, which consists in taking skin biopsy from patients, and with the skin biopsy we can generate stem cells, and from these stem cells we can generate model of the blood vessel of the brain and study the pathogenic mechanism underlying the disease, but also generating model to screen for new drug and new therapy. The funding from the foundation was really helpful. I need this sort of bridge of funding to establish my group as independent research, as a mid-career fellow. Timing-wise, it was exactly the type of fellowship that I was looking for, and enabled me to do the research I want to do, to generate this first manuscript, and also to generate the initial funding that will allow me to apply for senior fellowship, and also apply for future grant to fund my research.